All right, so today we're diving deep into, well, not exactly,
It's that pain or discomfort we get up here in the upper abdomen.
right? And we're going to be using this really interesting visual guide from the UK's National Institute for Health and Care Excellence to kind of break it all down.
It's based on their nice guidelines.
Nice guidelines. There we go. So the goal today is to figure out, not just what dyspepsia is, but what you can do about it if it's, something you struggle with.
Right, exactly. A roadmap to get you feeling better.
Have you ever dealt with dyspepsia? You're a bit of indigestion after a big meal, right?
Yeah, it can be a whole range of symptoms, like that burning sensation, heartburn, bloating, even nausea sometimes.
Yeah, it makes you feel pretty awful.
It does. And the tricky thing is dyspepsia itself, it's not actually a disease.
It's more like a symptom of something else going on, right?
Yeah. Exactly, like a warning light flashing on your car's dashboard. It tells you something's up, but it doesn't tell you what.
Perfect analogy. So this guide, where does it start? How do we figure out what's causing this warning light to go off in the first place?
Well, first things first, right? We got to look at the urgent stuff.
The red flags section.
Exactly. The red flags, those warning signs, those symptoms that, really need immediate attention. If you're having difficulty swallowing, like really struggling to get food down,
Yeah.
that's called dysphagia, by the way.
Dysphagia, okay.
Or any unexplained weight loss, dropping pounds without trying, persistent upper abdominal pain that just doesn't go away. Um, Oh, and for those over 55, any new onset dyspepsia, like if you've never had it before and suddenly it starts cropping up, that's definitely a reason to call the doctor.
Those are some pretty serious signs. You definitely don't want to mess around with those.
Absolutely not. And if you have any of these red flag symptoms, your doctor's probably going to want to do an endoscopy.
Yeah, endoscopy, I've heard about those. Isn't that where they kind of put a camera down your throat?
That's basically it, yeah. They use this thin, flexible tube with a camera on the end, and they can look directly at your esophagus, your stomach, and the duodenum.
The duodenum. That's the first part of the small intestine, right?
Right after your stomach, yep. And they can see if there's, any inflammation, ulcers, anything abnormal going on in there.
So if you have those red flags, you're probably looking at an urgent endoscopy.
Right. But the guide also talks about routine endoscopies too.
Oh, okay. So in what situations would someone need a routine endoscopy?
Well, if you're over 55 and your dyspepsia just doesn't seem to be responding to initial treatments, the things we try first.
Like lifestyle changes and things like that.
Exactly. Or if you're having nausea and vomiting along with the dyspepsia, your doctor might recommend a routine endoscopy.
Okay, so that gives us a look inside. But what about those situations where you might need a broader picture?
You're talking about imaging, right?
Right, like x-rays or...
Yeah, x-rays, ultrasounds, CT scans, those come into play when, maybe the doctor is suspecting something more serious, particularly if there are, additional red flags like jaundice, which is that yellowing of the skin or eyes.
It could be a sign of liver problems, right?
Exactly. Or abnormal liver function tests, a palpable mass in the abdomen, or signs of peritonitis, which is inflammation of the lining of the abdomen.
Okay, so we've got our symptoms. Maybe we've had an endoscopy, maybe some imaging. What's next?
Now the real detective work begins. We move into the differentials section.
Differentials. That sounds complicated.
Not really. It just means the doctor is considering all the possible causes for your dyspepsia, based on everything they've gathered so far. And they start with the most likely culprits, especially for, those under 55.
And what would that be?
Well, the most common one is something called functional dyspepsia.
Functional dyspepsia. So that means there's no obvious physical cause, right?
Exactly. Your tests all come back normal, endoscopy looks fine, but you're still having those uncomfortable symptoms.
So what's going on in those cases?
Well, it's thought to be related to how your stomach muscles are contracting or maybe how sensitive your gut is to stretching. Your body's just not processing things quite right.
Okay, so that's functional dyspepsia. What are some other potential causes?
Well, peptic ulcers are fairly common. Those are open sores in the lining of your stomach or duodenum, can be really painful.
Ouch, yeah. What about reflux? That's heartburn, right?
Yep, that's when stomach acid kind of splashes back up into your esophagus, causing that burning sensation.
And I see here the guide also mentions some pretty scary possibilities like cancer.
Yeah, cancers affecting the upper GI tract, like the esophagus or stomach, those can certainly cause dyspepsia-like symptoms. And it also mentions HPB cancers.
HPB, what's that stand for?
Hepatopancreaticobiliary. It's a mouthful. Basically, it refers to cancers of the liver, pancreas, and bile ducts.
Okay, so those can cause dyspepsia-like symptoms too. It really highlights how important it is to get a proper diagnosis, right?
Absolutely, because once you know what's causing the problem, then you can start talking about management. And that's where this guide gets really helpful. It lays out a whole spectrum of strategies.
Yeah, it starts with lifestyle changes, things like quitting smoking, cutting back on alcohol, aiming for a healthy weight. But honestly, do those really make a difference?
Oh, you'd be surprised. Especially for, functional dyspepsia and reflux, those simple changes can be huge. Then, of course, there are dietary modifications too.
Like avoiding trigger foods.
Exactly. Figuring out what foods seem to set off your symptoms and cutting back on those could be fatty meals, spicy dishes, coffee, even peppermint for some people.
Yeah, peppermint always gets me.
Yeah.
But sometimes, even with lifestyle changes, you need a little extra help, right?
Right. And that's where medications come in. The guide talks about trying PPIs,
PPIs, what are those?
proton pump inhibitors. They reduce the amount of acid your stomach produces. They can be really helpful for reflux and peptic ulcers.
Okay. Anything else?
Another option is antispasmodics, which relax the muscles in your stomach and intestines, helps reduce cramping and pain.
Interesting. So we've got lifestyle changes, dietary modifications, medications, but this guide goes even further, right? It mentions specialist referrals, trying low-dose antidepressants, and even psychological therapies.
Yeah, and I think this is really important to highlight because dyspepsia isn't always just a straightforward, physical issue.
Right, because stress can play a big role, can it?
Absolutely. Anxiety, stress, those can definitely worsen symptoms. So things like cognitive behavioral therapy, CBT, that can be really helpful for learning how to manage stress and cope with chronic pain. And then if your dyspepsia is, related to nerve damage, like in gastroparesis, which is delayed stomach emptying, a specialist can help you manage those symptoms.
It's fascinating how interconnected everything is, our minds and our bodies.
It really is.
So I think we've covered a lot of ground here. We've learned that dyspepsia is a common problem, but with a wide range of potential causes, everything from simple lifestyle factors to more serious conditions.
Right. And that understanding those red flags, the warning signs, that's so important.
Absolutely. And knowing about the diagnostic options, like endoscopy and imaging, and the different treatment approaches, can really empower you to, advocate for yourself and seek the right care.
Exactly. And while this visual guide is a fantastic starting point, it's crucial to remember that everybody's experience with dyspepsia is going to be unique.
Right. What works for one person might not work for another.
Exactly. So if you're struggling with dyspepsia, don't hesitate to talk to your doctor. They can help you navigate this whole process, figure out what's going on, and create a personalized treatment plan that addresses your specific needs.
And of course, if your symptoms worsen or you experience any of those red flags we talked about, seek medical attention immediately. Don't wait.
Couldn't agree more.
Well, thanks for joining us for this deep dive into the world of dyspepsia. We hope you found it informative and helpful. Stay well, everyone.
And remember, if you're